Well, good afternoon. My name is Lee Harris, Mayor of Shelby County and co-chair of the Joint Task Force. Pleased to be here. We are still in the fight against COVID-19. I know we have been in this fight for several months, but we must continue the course. We know, by the way, that this virus affects communities across our entire state, and there's not a rural virus and an urban virus. There's just one virus that we're all confronting right now. And it's important what happens in Shelby County and our urban areas, but also important what's happening in our rural areas. All of us around the state have seen various ups and downs, and all of us have to continue to work at this to mitigate the risk of spread. This afternoon, in addition to the usual reporting around the data and opportunities for questions, we have some very special visitors from Haywood County and the Brownsville area to talk about what is happening in those areas. Again, we know that what happens outside of Memphis and Shelby County affects Memphis and Shelby County. What happens in Memphis and Shelby County affects all the areas around Memphis and Shelby County. And so it is critical that we continue to collaborate, and there's been a great spirit of collaboration between all of the counties and leaders in our region, and so that collaboration will continue. Obviously, speaking for myself, we hope that we see a little more uniformity at the state level. It would be great, for example, to see a state intervention in terms of masks and some other protections that could apply throughout all the communities in our state. But until then, all of us have to keep working together, have to keep collaborating as local communities until we get a treatment or a distributed virus, or until we see an aggressive intervention from the state. We know that this continues to be important. Just yesterday, there was a report from Vanderbilt that suggests that the counties that had taken aggressive intervention measures saw half the number of deaths as counties that did not take aggressive intervention methods. So we all have to keep working toward this. We all have to continue to understand the science. It's constantly changing and becoming harder by the day, but we can make it to the other side of this, and we must continue the course.